Jennifer is a 30-year-old biracial woman. Her father was Caucasian and her mother is Filipina. She grew up in Seattle but now resides in Dublin, Ohio. Her father died when she was 3 years old and her mother remarried shortly after. Jennifer's stepfather had an explosive temper, and while he never physically abused, she and her brother and the entire family lived in fear of his outbursts. Jennifer's mother became more and more withdrawn as the years went on. She went through long periods of what she called feeling blue. During these times, she would sleep on and off all day, crying frequently, and didn't have the energy to complete even the most basic household tasks. Jennifer took on many of her duties as time went on. Jennifer always swore to herself that her life would be different. She married an even-tempered man, Jeremy, who was kind and reliable. She is the proud mother of 3 wonderful children, ages 2, 4, and 7. Jennifer is a stay-at-home mom, and her life revolves around her family. She does have a number of casual friends, also young mothers, that she has coffee with, but has not maintained any deep relationships with in the years, since she has stopped working outside the home. Jennifer and her husband, a physician, moved to the suburbs of Columbus, Ohio 3 years ago when he was offered a position at the Ohio State University Wexner Medical Center. Jennifer reports that she has not felt right since the move. She describes herself as unmotivated and tired all the time. Jennifer frequently cries and often feels hopeless. When asked if she would ever harm herself, Jennifer denies that she would, but she does go on to say that sometimes she wishes she would fall asleep and never wake up again. Jennifer eventually undergoes a psychiatric evaluation and is diagnosed with major depression. Major depression is a mental disorder characterized by persistent depressed moods and long-term loss of pleasure or interest in life, often with other symptoms such as disturbed sleep, feelings of guilt or inadequacy, and suicidal thoughts.
The city of Dublin, Ohio has about 44,442 people residing within it, with the median age of 39.7 years. The majority of people from Dublin identify as white alone, with significantly less for all the other races. Jennifer identifies with being 2 or more races, in which only 2.5% of the Dublin residents identify with. This is largely different from Seattle, where her and her husband moved from, in which 7.65% of the population there identified as being 2 or more races. The median household income of a Dublin resident is about $129,000. However, Jennifer's husband makes significantly more than that, bringing home about $381,000 a year.
For insurance, Jennifer's family has it through her husband's work at the Ohio State University's Wexner Medical Center. This insurance is known as Prime Care Advantage. The overall deductible for a family is $900. Their dental plan is through Delta Dental, and they have the Premier Network, costing $50 per person for the deductible. Vision is through VSP Global, and the annual deductible is $25 per person.
Looking at the average income of a physician working in Dublin, Ohio, we calculated Jennifer's husband to make $382,000 per year, or $31,833 per month. This first chart shows the family's monthly budget after subtracting federal and state taxes, health insurance, the retirement plan, dental and vision, and Social Security. This second budget chart shows how the family will likely spend the remainder of their income. They are left with $17,035 a month after taxes and insurance. We calculated that they would spend $2,175,000 a month on their mortgage for a $600,000 home on a 10-year fixed plan. We estimate a down payment of $120,000, which is equal to 20% of the cost of the home. Additionally, we calculated they would put $5,000 a month into college savings for the kids and other emergency needs. This leaves the family with $5,035 at the end of each month. This is the kind of home Jennifer and her family would live in for $600,000 in Dublin, Ohio. It has 5 bedrooms and 4,230 square feet.
Hi, Jennifer.
Hi.
How are you today?
I'm good, you?
Good. I'm Dr. Francis. I work at Ohio State Medical. So how have you been feeling lately?
I've been feeling a little down and just not feeling like doing anything, really unmotivated.
I'm really sorry to hear that. Is there anything in particular that's making it hard for you?
Nothing in general, it's just like everything like piled on together.
It sounds like you're struggling from a little bit of depression. Not making a diagnosis now, but it doesn't sound too good. One thing that we often do is prescribe some medication for that. Is that something that would interest you?
No, it's against my cultural beliefs.
Okay, I completely understand. In that case, I would like you to see one of my colleagues, Lisa Simon, who is a clinical mental health counselor, and she's worked with a diverse population. Apart from these feelings of sadness, I would like to know how you're taking care of yourself. Are you sleeping often? How has your sleeping schedule been going?
I haven't been able to sleep very much lately. Like, I'll want to go to bed, but I can't fall asleep, and then once time to get up in the morning, I don't want to get out of bed, even though I haven't slept.
Okay. That's not uncharacteristic. Depression can cause some insomnia or just sleeping issues in general, and there's some techniques that can help with that. I would suggest creating a bedtime routine, and then avoid using your cell phone before you go to bed. That can make it harder to fall asleep. Also, if you just do 30 minutes of a relaxation exercise or reading a book, can help you get to sleep as well. You can also find a quiet spot and do some exercises before bed and practice your breathing as well. Sleep hygiene is really important, crucial to your brain function, and it can really help you. Also, in the morning, it can be great if you have a hard time getting up. Waking up just a little bit earlier, setting that alarm a little earlier, can adjust your schedule and make it easier to tackle the day. What about exercise? How often do you exercise, and what kind of exercise do you do?
I used to exercise 3 to 5 days a week. A lot of cardio is my main thing.
Cardio, that's good.
Ever since we moved, I've been finding it harder to go because I don't have as much family over here to watch my kids for me to be able to go to the gym. So I feel like that's been one of my big things, is I haven't been able to exercise as much.
Yeah, I would definitely say exercise is a great thing. It offers a lot of health benefits, and it can definitely help reduce that depression. Both high and low intensity exercises can be beneficial. The cardio or high intensity exercises releases the feel-good chemicals known as endorphins into the body, so that I think that could really help you out. If you're just getting started back into it, I would say just start with 5 or so minutes, just walking or doing any enjoyable activity, and gradually increase that time over the coming days and weeks and months. How's your diet been lately? Are you eating?
I haven't been eating much lately. Like, I'll cook dinner for like my husband and my 3 kids, but if anything, I'll eat like 2 bites, and I don't want to eat at all.
Well, I just have a couple recommendations for your diet. First of all, it would be great to eat more like whole grains, fruits, and vegetables, and eating things with fish, poultry, eggs, and spinach. Fish contain omega-3 and are a great supplement. Also, make sure to stay hydrated. 6 to 8 glasses of water is really important, and avoiding caffeinated drinks such as soda or coffee. Also, are you currently drinking, smoking, or taking any other substances?
No.
No, that's good. Staying away from alcohol is, a lot of people struggle with that. With depression, they want to cope with something, and that's not the best coping mechanism. And I think actually for you, one of the best coping mechanisms could be cognitive behavioral therapy. And this kind of just changes the way you look at things. Some things we can do to avoid depression. One of the best things you can do is avoid stress. So there was actually a 2012 study conducted with veterinary students that found that stress had a negative impact on mental health, life satisfaction, and general health. So there's a variety of factors that go into this. Everything is affected by it. So work, education, family life, or relationships can cause this stress. And it's important that we can work together to try to manage and address some of these stressful situations. As much as possible, you should try to avoid triggers that can cause this stress or anxiety for you. It would be great if you could talk to me later more, or one of my colleagues, about what triggers your depression, and we can work through that to kind of avoid those situations or make you think about it in a better way.
I'd be willing to do that.
Great. There's a lot of natural techniques we can use, instead of medication, and lifestyle changes as well. And I think it would be great if you could work with a coworker of mine that I think you would benefit from. Her name is Samantha Wood. She's a fabulous multicultural advisor, and she can kind of help you get involved in the community more. And yeah, so just make sure you're getting that exercise. Spending times outdoors is really important too. It's great that you're not using any substances or alcohol, and it's just really important that you continue to get good sleep or get better sleep. Thank you so much for sharing everything you have with me. The only thing I need from you right now is to sign a medical release form, and this just allows me to talk to my coworkers about your personal information. You want to read that over. But yeah, this form just allows me to talk with my colleagues about your personal situation so we can formulate a treatment plan for you. Thank you so much.
Thank you.
Have a great rest of your day.
Beautiful.
Yes.
Hi guys, so I just met with Jennifer, and it went pretty well, but she's been saying she has some concerns because she's not been feeling that motivated lately. Her sleeping has not been going that great, and she overall just feels really unmotivated to do things with her kids. I asked her about her diet and her sleeping, and overall I think there can be some changes. She wasn't open to using any medication for her cultural reasons, so it'd be great if we can do some alternative remedies for that. So I would look to you, Sam, for some multicultural elements. And then also, my expertise could be better on the mental health side. So I think, Lisa, it'd be great if you could talk to her more about that. Could you just give us a little overview on what you could help her with?
Yeah, so my role as a mental health counselor, probably do a little back depression inventory just to make sure that that is her diagnosis, and maybe even get a family history to see if there's anything in the background of that. And then depending on a lot of the things that are bothering her, we could potentially do a couple different treatment options, like cognitive behavioral therapy is one that's particularly been effective, kind of like reshifting the thoughts of the mind. But definitely like going over that with her, because I want to make sure that the treatment is what will work best for her. But Sam, I think you'd be really helpful in that culture aspect, because I'm not really keen on that, so I think kind of the two of us working together with her on that would be helpful.
Yeah, absolutely. I can suggest some like natural supplements and at-home remedies that she could follow up with to see if that's something she wanted to do instead of, like you said, she doesn't really prefer the medication aspect. So we could do something like that.
Cool.
Absolutely. So I'll get you guys in contact with her. I had her sign the medical release form, so that's all set. So I'll just give you guys her contact information, and you guys can each speak with her individually.
Perfect. Great. And then we can meet up later and just kind of talk about how we've been doing with her.
Absolutely.
Awesome.
Right. Thank you guys so much.
Thank you.
Thank you.
Hi, Jennifer.
Hi.
It's nice to meet you. My name is Lisa Simon. I'm a mental health counselor. So Dr. Francis told me you weren't really feeling like yourself. Do you mind just telling me a little bit about what's been going on with you?
So about 3 years ago, me and my husband and our three children moved from Seattle to Columbus, Ohio, and ever since the move, I just haven't been feeling myself lately. I've just been super unmotivated, haven't been able to sleep, haven't really been eating. Just overall, just not been myself.
Oh, I'm sorry to hear that. It must be really hard. You said it's been happening for how long? About
Like 2-ish years. I thought like when we first moved, I was just adjusting, but I don't know. I'm starting to think that there's something wrong.
a little bit more going on potentially.
Yeah.
Have you ever thought about harming yourself or others before?
I've never thought about it, but I have thought about just falling asleep and never waking up again, but I would never hurt myself.
All right. Well, thank you for telling me and being honest with me. Hopefully I can help you kind of get those feelings to go away. Do you mind telling me what your life was like before coming to Ohio and Seattle, and just like if anything's different from those two places?
Yep, so in Seattle, I had all my friends and my family surrounding me, so it was a little bit easier just to be with life and stuff. In my Filipino culture, we don't believe in other people like raising our kids, so it was easier in Seattle when I had like my parents and stuff like that with me, because then they could watch our kids while we either went on a date night or I could go to a part-time job or anything like that.
Yeah. And you've kind of been struggling, like readjusting with not having family and friends around you?
Yeah.
Yeah, that's completely understandable. Those are your support systems, and I know it must be hard not having them around. What is your life like at home? Do you have kids? Like, what's going on there?
Yep, so we have 3 kids, 2, 4, and 7. I'm a stay-at-home mom, and my husband's a doctor. So I'm oftentimes alone with them at home, which can be stressful, and I get bored because it's just doing the same day-to-day tasks over and over again.
Absolutely. You definitely have a lot on your plate and some kids at home. I noticed some symptoms of depression. Do you happen to have a family history that you'd mind sharing with me?
Yes, my mother, she's was diagnosed with depression when I was younger,
Okay.
after my father had passed away.
What was that like growing up? Did you see her any symptoms?
Yeah, she like was often crying, and like she'd just be sleeping on and off throughout the day, and as a child I had to take over most of the tasks of the household.
Oh wow, that must have been hard for you. It does seem like you have some symptoms, but just to make sure, I'd like for you to fill out a back depression inventory if that's okay. I have it right here for me. It's just 21 questions. You just read them and circle which one you feel most aligns with how you're feeling. So if you don't mind doing this to me, I'll actually leave the room just so you have some privacy, and then when I get back, we can look over it together and then see where to go from there.
Okay.
Thank you. All right, are you all done?
Yeah.
All right, thank you so much for doing this for me. Looking through it, it does seem like you do have depression. Just so you know, there are plenty of treatment options, and I hope that I can help you figure out which one works best for you and your values. One of the ones that's most common is medication. Do you have any feelings about receiving like antidepressant medication?
I would rather not because of my cultural belief system. I'd rather like natural home like remedies.
Absolutely, and there are totally so many options for that, so it's not a problem at all. One of the most common and useful that I have found for depression is cognitive behavioral therapy, where we kind of like reshift your thinking in negative patterns to more positive ones. Does that sound like interesting to you?
I would be willing to try it.
All right, that's awesome. I have provided this pamphlet just so you can bring it home and read through it if you'd like before we even get started.
Okay.
And one of the most important parts of it is we make a lot of goals together, and then before each session we figure out what we want to talk about and plan it out so that we both know what to anticipate.
Mm-hmm.
And typically we'll meet once a week for about 50 minutes, and then there's some homework for you to do during each week just to like make sure that you're still working on it.
Mm-hmm.
Does that still like sound like something you would be interested in?
Yep.
Perfect.
Cognitive behavioral therapy is a form of psychotherapy based on social learning theory that emphasizes how our thinking interacts with how we feel and what we do. It's based on the view that when a person experiences depression, anxiety, or anger, that these stressors can be exacerbated or maintained by exaggerated or biased ways of thinking, and that these patterns can be modified by reducing erroneous and maladaptive beliefs. A counselor using CBT helps a client to recognize their style of thinking and to modify it through the use of evidence and logic. There are two critical components of CBT: functional analysis and skills training.
And then I also have this list of crisis phone numbers in case something happens or you start to feel really down. These are available for you at any time, 24 hours a day, and there's a national hotline as well as one for the county.
Okay.
And please feel free to either reach out to them, or also I'll give you my phone number so you can reach out to me as well. And then I know you have some cultural issues that you would like to handle as well, and that's not really my forte, but I know Dr. Francis had mentioned Samantha Wood, and she's a very good resource that I think would be valuable to you as well as working with me.
Okay.
Do you have any other questions before we head out and maybe plan our next session?
I don't think so at this moment.
All right, well thank you so much, and I hope to see you again soon.
Thank you.
Hi Jennifer, how are you?
Good idea.
Good, my name is Samantha Wood and I'm here to talk to you about some more like multicultural aspects of what we can do to help you out with your depression. I've talked with my colleagues, Lisa and Dr. Francis, and we've kind of discussed what kind of ways it would be best to help you get through this. Some natural remedies that I have found. Here's a pamphlet on them. There's like 5 different ones that I really recommend. There's one called St. John's wort. It kind of like acts like a standard antidepressant drug, and it helps to treat mild to moderate depressive disorders. So it like promotes relaxation and can boost energy levels, which is really great in your aspect because you have been sleeping a lot. So maybe that'll help you, get up during the day and participate in more healthy behaviors. There's another one in there called maca, which is a root vegetable with amino acids, minerals, and vitamins. That would be really great to help you with, your just daily activities and things like that. Because I know you said you weren't eating very much, so that will probably help you get the proper nutrients in your body that you need. I also, just before you do anything, I would talk to Dr. Francis just to double check to make sure that this is something that he recommends for you. I believe that it's a good idea, but you would talk to your physician first. And based on these things, I found some natural food stores where you can pick up some different natural remedies, and you have a Trader Joe's and Whole Foods near your home. So hopefully that would allow you to be able to go pick up some stuff if you need. Does that sound like a good plan?
Yeah, sounds like a really good option.
Cool. So another thing that I found was an acupuncture center, and it's for Chinese and herbal medicine.
The acupuncture center recommended to Jennifer has a diverse number of helpful services ranging from fertility, headaches and migraines, as well as stress, anxiety, shock, and grief. The type of acupuncture that was suggested to Jennifer is the stress, anxiety, shock, and grief kind. The website reports that this kind of acupuncture can reduce symptoms of chronic emotions along with sudden ones. Some stressful situations can impact a person's digestive issues along with sleep deprivation and panic attacks. This acupuncture center provides help with all of these symptoms and more.
So I know you're from Southeast Asia, so this is probably something that would be interesting for you to look at. We have a lot of stuff about, the body and mind connection, how, your mental health impacts your physical health. So hopefully, you can go to get acupuncture and have like a good release of like those stressors and, kind of relax a little bit more. I feel like that would be good. And I found 2 multicultural therapists, if you're interested in that. I know that you spoke with Lisa and talked with her about some stuff like that, and I don't know if you're comfortable with her or looking for someone, you know, who's more in your realm. I found Susan Belair, who's a multicultural therapist in Columbus. She really, like, one of her statements that really like came out towards me was that she works together to honor your authentic self. So whether that be, you know, following your Filipino culture or trying some new varieties, I feel like that would be really beneficial for you. She wants to also help you remove obstacles from your life too, and, you know, whatever you're facing, I feel like that would be really great. There's also Elise Park, who I found. She's another multicultural therapist who I think would be able to help you. She's younger. She's lived all over the US and abroad, so she has a lot of different experiences working with a variety of people. She also specializes in anxiety, depression, and life coaching, so I feel like that might be really good avenues for you to look at.
Like Lisa, but I feel like a multicultural therapist would also be good because they might offer some things that she does not.
Yeah, perfect. You can like look into these two women. They both look like really great people based on their references and things like that, so I feel like that would be really helpful for you.
For Jennifer, 2 multicultural therapists were recommended. Both are located in Columbus, Ohio. The first is Susan Belair from New Vistas Counseling. Her methods are trauma and oppression informed, healthy relationships, thoughts, feelings, and behaviors are all important. She provides information that she uses a variety of types of therapy to help appropriately treat depression. Susan also has multicultural abilities to understand and involve cultural aspects into her healing. The other counselor is Elise Park from Counseling Care Circle. She has lived all over the United States and abroad. Elise uses her diverse experiences to help with many patient needs. She specializes in anxiety, depression, and life coaching. Her background also allows her to work with spiritual beliefs, women's issues, and somatic symptoms and pains. Elise is also available through Skype and phone calls.
I also found a website for an Asian American Community Services nonprofit that I feel like would be really beneficial to you. Here's some pictures and about what they do, and, you know, they want to help people who are in mainstream American society and kind of incorporate, you know, your culture into more diverse areas and things like that, so more people understand what you're going through and, you know, what your culture is like. So I think that would be a good thing to do, to reach out, and I can get a pamphlet for them if you'd like to look into that.
Yeah, that'd be awesome.
Perfect. And the last thing that I want to talk to you about is a preschool that I found for your 4-year-old. They take 4 to 5-year-olds. They are in Columbus. It's called Hilltop Preschool. They want to give children social experiences and educational tools to be successful. Like most schools, they really have great goals for your children. They also really provide developmental, social, and emotional skills to be able to work like in the community and things like that. So I feel like that would be really great for you to look into. And I know one of your things is that, you know, people from the Philippines don't really look into letting other people watch their kids. And Dr. Francis had mentioned that to me. So with this preschool, they encourage parents to come in during any hours of the day and sign in and just come in and like be with your kids while they're in preschool and kind of just hang out with them and figure out what kind of environment they're in, if that's something that you're interested in doing.
Yeah, that'd be interesting to me. It's just like you said, I don't like other people watching my kids, but if I'm able to go there like while they're there, maybe eventually I'd feel more comfortable.
Yeah, absolutely. They have here, let's see, their website says that they would like parents to attend family events, field trips, and special lunches, or to just stop in and visit and say hi and just kind of communicate with the teachers and, you know, hang out with your children. So I feel like that would be a good option.
Yeah.
All right, well, thank you for coming to visit me. I hope this stuff is useful to you, and if you have any questions, you can just contact me, and Lisa and Dr. Francis are also great resources for you.
Great, thank you.
Yeah, thank you.
Hi, Jennifer. Good to see you again.
See you too.
So how was that meeting with Lisa Simon, the clinical mental health counselor?
It went really good. I was really nervous at first talking to anybody about depression and things like that because it's just hard for me to talk about. She did bring up some great treatment options though. She gave me this flyer for the CBT that you mentioned before. And I read over it. It sounds like something I'd be willing to do, so I'm excited to get these thoughts out of my head.
Awesome. I'm so happy to hear you're open to this. I think that'll be a great option for you. That can really make a difference for a lot of people. What about Sam? I know she has a lot of multicultural
Yeah.
experience?
So she also gave me a couple more packets and pamphlets. She gave me these two like bios for two multicultural therapists in my area. And I'd be willing to look at those as well, especially because I feel like they could offer a little bit more insight to like my cultural beliefs and backgrounds that Lisa might not be able to. I'm still willing to meet with Lisa, but I'm interested in talking to them as well. Sam also gave me this packet about some herbal remedies that I could possibly do. This one that's called St. John's wort, it sounded interesting to me, but I don't know. I wanted your opinion to see if it'd be the right fit for me.
Yeah, I do know a little bit about St. John's wort, and I think that would be a great remedy for you. And you have the okay from me. Definitely let me know how that goes if there's any issues.
Okay.
St. John's wort is a plant that is native to subtropical regions of the world and has been used among many cultures to help treat depression. Many studies have been done on St. John's wort. One, done by the Cochrane Systematic Review in 2008, found that this plant is at almost the same effectiveness as standard antidepressant drugs at treating mild to more intense symptoms of depressive disorders. When taken as a whole extract, St. John's wort has been shown to naturally aid in sleep disorders, help promote relaxation, and improve energy levels. This is considered to be a safe herbal remedy that can help with an individual's overall mental health.
Great. I think these are all perfect resources, and I hope they can help you even more. So I just have to meet back up with those guys, and we'll formulate a more cohesive plan for you, treatment plan, and just make sure to keep us updated on anything at any time. You have all of our contact information, and we just want to make sure that we can help you the best we can. But thank you so much.
Thank you.
All right, guys, so I just met with Jennifer for the second time, and she said she really enjoyed the meeting she had with you guys. She got a lot of valuable resources from you guys. And yeah, I think we just got to continue making a plan for her, keep up to date, kind of reach out to her if she's not reaching out to us so much. Is there anything else you guys wanted to add in particular that would help her out?
I just wanted to let you guys know I did a back depression inventory on her, and it came out as she having moderate depression. So I just want you both to be aware that she does have a diagnosis now, and that I think I'm going to move forward with cognitive behavioral therapy for her. She seemed very interested in it, and I've seen a lot of success with my other patients, so I think I'm going to try that with her.
And Samantha, I saw the packet on St. John's wort.
Oh,
that seems to be something that could really help her out.
Hopefully, yeah. We looked into it, and hopefully she goes to one of the health food stores I recommended, and she'll pick some up. So we'll see.
Great. I think other than that, it would be great to get her involved more in the community. It'd be great to, maybe get her in like a yoga class or something where she can get with other Filipino moms doing something, and get her kids involved too, because I know socially she's lacking in a lot of areas. And I think one of the best ways we could do that is maybe find someone like a peer specialist, to get her involved in that. I think that's something that she could really benefit from.
That sounds great.
Sam, do you know any people that you've worked with in the past that might be offer to be a peer specialist for her?
Yeah, absolutely. I have tons of references here that we could talk about at a later date.
Absolutely.
Perfect.
Awesome.
Cool. Thank you, guys.
Thank you.